Thank you very much, Joyce. Again, I think it's just fantastic to see innovation, and regardless of its form, whether it's high tech, low tech, this is about people, it's about collaborations, it's about thinking outside the box, it's about thinking in different ways. Great lead in to probably the next topic. Paul, my success or failure regarding timekeeping is now solely down to you. So no pressure, but if you could maybe just steer us into the world of more of the high tech stuff. There you go, just that one there to move forward.
Thank you. Okay, thank you, Brendan. Good morning, ladies and gentlemen. So I'll try and keep this very brief. Excuse me, I think I've a bit of the cold Joyce had as well, so you'll have to bear with me. As with any, the good news is, as with any technology service, live service is probably best seen to understand it. So with that, I'll give you a very brief overview of the company and why, what, you know, where we came from, what we set up to try and achieve, and the service is running live in the far corner, so we can go into more detail there. So I suppose we set up as a company a number of years ago. In 2012, the company was founded by both medical consultants and engineers, and the sort of the broad vision was to look at how technology could enable people to live independent lives. It wasn't radically new; it has been done before, and it continues to be done. But I suppose we want to have a look at why certain elements of technology has probably not done as well as it should do, and we looked very much at you know, how could mobile technologies help people live independently. People broadly, we talked about, you know, people in aging, but also this had particular relevance in areas for dementia sufferers, for people with learning disabilities. And we want to understand what were the challenges, why, you know, how do these things need to be applied in a practical way. So both Barbara and Joyce have said correctly about low-tech innovation and high-tech. I think it's about innovation technology applied in a pragmatic, practical way, as opposed to, you know, so I see some of the things, you know, just because we're involved in technology, we try not to be involved in technology for technology's sake. When I think about some of the things we did a few years ago and thought we had all the answers, I'm nearly shameful, because, you know, it's what we did a few years ago and then took in all the feedback along the way and said, well, actually, this is how this will work, and this is how, you know, this is how these things could be applied. That actually shaped how we do, how we approach the market today. But that was sort of broadly why it was set up, and the founders had a very strong background actually in product concept and bringing to market. The consultants themselves had been involved in a range of private hospitals, which are still in existence in Ireland today. The engineers had been involved in a number of other things. So they'd, you know, they knew what they were doing. Last year, a global company, a global mobile operator, came in and became a significant shareholder. And it did two things, obviously. It gave us, I suppose, the backing and the support to deliver against what our ambitions were, and more importantly, what our partners were, and to understand that, you know, whilst we might have been an early stage company, we've 38 engineers qualified to Masters of Engineering. We've our own manufacturing in Ireland, because we knew without that, you can't take something from a shelf. You have to have the ability to take feedback, go back, re-engineer, remanufacture, constantly improving the cycle. So it was a big overhead. Unfortunately, we found a partner who understood the necessity for that sort of an overhead. We've some of the usual things. Just we went through all the relevant certifications, and I say ISO on track, because if anyone goes through that, you know, it's a series of audits, and it's painful, but fortunately we'll be there in the next week or two. I mean, we looked at how technology could be applied, and we were, you know, primarily we want to look at areas of using. We talked. Joyce talked about GPS. We used to talk about location services. GPS is one technology we use to give, you know, to give people's accuracy in their location. Accurately, we talked about, you know, fall intervention. We said, you know, how do we accurately predict falls, and how can we tell the severity of fall? We talked about mobility. So one of the key themes which we've heard this morning, and which we see across, you know, plenty of aspects, I suppose, of aging, was, you know, there's been great technology developed in the past to alert someone if something happens in the home. What about when you want to get outside the home? And the idea that, you know, we're all living longer, but a lot of people are living longer with certain conditions that might mean they're more inclined to stay in the home if they believe home is the only safe place. That in itself is a problem, because a lot of the time these people do better out, certainly being at home rather than being in a hospital environment, but being at home and being in the community, being out interacting every day, even if it's just a walk down to the shop, if it's, you know, depending on what people's levels of ability are, but certainly get out. Do not, you know, try and avoid social isolation, and try to get to social inclusion. So we said, right, if people want to be out and about, they want to be moving, everyone knows it's well. Mobility is good from both a physical and a mental aspect. What sort of blanket of security and reassurance can we give to those people to allow them live their lives as accurately and as reflective as they want to live it? So not that people are restricted to living their lives because of what technology is there to provide or because of the system, but what could we do to allow people to live as real as they want to, and how can we support that? So I suppose we looked at that, we sort of we spent a long time working with people, and then we turned into an engineering problem. And said, right, well, why did things fail before? What can we do to make sure that these things don't fail in the future? And I suppose one of the key things for us was it's not actually just we talk about we've arranged things with a very small discrete care clip which people carry with them to mimic the body movement. We have an app. We'll be arranging a number of other form factors very shortly, to be announced very shortly, and the idea of it to be able to give people the ability to consume a service the way that is most appropriate to them. But really, the key for us was actually trying to alleviate the stress on I suppose the service user, but also, and again, Barbara mentioned this earlier, the carer, the minder, whether that's the formal or the informal network of care. We said, how can we be of help to the entire ecosystem, and also our partners? And I don't believe, there's plenty of people who are in this space and might, would say they're competitors. I think the idea of this isolated competitive market is wrong in this space. I believe it is an ecosystem, it's collaboration. There's enough of a problem out there that for all of us to try and collectively solve. So, we suddenly realized, right, deliver the most robust services that do exactly what they say they'll do in terms of being able to find someone wherever they are in the world within 1 second, deliver a very accurate fall detector, deliver, be able to give people the ability to call on a panic alert, have a two-way voice situation that someone can reach out and check in with you. But more importantly, actually have this all in a back-end platform that can be interacted with the next of kin, the carer, can be very easily used, as well as that data and understanding why we went through the ISO processes, because we're very conscious of people's privacy and data. But that data, even at an anonymized level, can go into a care plan. And then also that data can be vitally important for our partners who can do things far better than we can. So the idea was to be able to give the user the services to help them live an independent life, whilst at the same time providing a platform that could become vitally important to the ecosystem and the partners, and allow them, hopefully make this, the environment a better place for people who are suffering from dementia, but also who are suffering from a whole range of things as they age. We changed just on this side, was just about the business model, which I won't go into. I don't think it's hugely relevant here, but as much to say that we stopped actually promoting ourselves a number of years ago and realized our best opportunity to support the system was to actually concentrate on technology, concentrate on what it can do to support people, but understand the role that technology has alone. Technology is only as good as the hands you put it into. And fall back into, trying to strip down our ego and our pride and not try and become a big brand, try and support, but become a platform that supports our partners' ambitions. So our whole thing was we call ourselves a white label partner. We are there to put our services in the hands of people who know how to use them best. Those partners are both commercial partners, but they're also non-commercial partners, looking at, they're looking after people. That's briefly what it does. I said, rather than trying to get Brendan some time back, that's best seen live service. So my able assistant out there, Mark, will happily take anyone at any stage. We're here for the day, happily take you through what it does. But it's basically what, at the very minimum, the services you'd expect to help people promote independent life. And from that, we do some very clever things in the back end. That's just, as I said, that's a screenshot, but we'll go into it. So I think broadly, we were very fortunate, as when I mentioned earlier on about getting the backing we got last summer, but I think from a mobile operator who was smart enough to realize this isn't a solution that's going to be solved by a mobile operator, because sometimes technology companies think they have all the answers and they make a complete mess of things and can actually be a distraction. So we had a mobile operator who understood that this is a long game, it's an expensive game. They agreed with our vision that we need to be here to support people, and they backed us on it, and then they stepped out of it. And they helped us bring everything we have to the right partners in the right markets to help them deliver their services. So we're live in Ireland, we're live across the Caribbean and Asia Pacific. And that has given us great exposure to some emerging markets. Again, Barbara, you alluded to it earlier, but we're in markets in the Caribbean that have massive wealth, and we're markets in the Caribbean that the majority of people are living on the street, and our services used at both ends of the spectrum. So it's interesting for us to understand how we can adapt our service to work where there is great structure and private healthcare, and where there's people who can barely afford housing, and they rely on their informal network of care of families. And our view is if you cannot adjust to both, well then, you know, as a technology provider, you've no role in this space. So, you know, I think that's given us, I won't say it's been easy, it's been fairly torrid actually, but it's at least I think it's given us a bit of an ability to be more agile and flexible than we otherwise might have been. Is that okay? Got you some time back?
Thank you
Thank you guys.